Good afternoon. Hello, hello. Thanks everyone for joining us today for this community town hall. We are always glad to be able to come to you to share information, try to answer questions, as we are all really curious about what's going on in our community and in our world, especially around COVID. Let me welcome our group of experts, as I'm going to call them. We have Frank Krupa, who is our mental health commissioner, as well as our public health director. Lisa Holmes, who is our interim county administrator. Amy Hendricks, who is our deputy county administrator and the person heading up our emergency operations center amidst all of this COVID stuff that's going on. And of course, me, Leslie McBean-Claiborne, chair of the Tompkins County Legislature. I want to start off this afternoon. There's just so much happening that I want to make sure that I acknowledge what's been going on across the globe in Afghanistan. Recognize and thank all the people who have been making the sacrifices, and some of them the ultimate sacrifice of their life for peace and for basic human rights. We here in Tompkins County wish only peace for the citizens, for the residents, for the people who are there, and that those who are Americans will be able to get home safely, those who want to come home, and that we as a country will do our best with our allies to try and support the people of Afghanistan in finding the right balance and peace that they are seeking. I also do want to take a moment to recognize and acknowledge what has been going on with our southern states. The devastation that Hurricane Ida has caused in Louisiana, especially. Some of what's happening even here in the Northeast, in New York City, in New Jersey, the Caribbean region. So much has been happening in our world, so much that's taken its toll on all of our mental health. We wish the people in Louisiana, particularly St. John's Parish, which is their sister city to Ithaca here, just the best in recovery, and hope that our government will reach deep and help those folks with their recovery. Hopefully not a lot of human life loss, that people don't have to suffer more than they have suffered already. Also reaching into California, the wildfires, they're wreaking havoc. And again, praying and hoping for the best recovery and for it to end. And of course, for all of us throughout the country and throughout the world dealing with the coronavirus and its many variants. We thought that we had hit a nice low earlier this year. And then here we are, ramping up again. Numbers are climbing. People are scared. I just got through traveling, and I love to fly. And I was scared to get on an airplane because I didn't know there's so many more unknowns that it is causing all of us to stay up at night and have heartburn as we think about what next. With my other hat on, just looking at all the precautions we took, in a GIAC, and knowing that so many of our young people tested positive, We just don't know. What we do know is what Frank and all of us have been preaching for, I don't know, 18 months plus, and is, to continue to follow the guidance of wearing our mask, distancing, making the best at home with family if we don't have to go out. Don't touch our hands or our face, and wash our hands as often as we can, or use hand sanitizers. We know that that level of guidance, and when we did it last year, we did well in Tompkins County. Yes, we lost some lives, and we want to acknowledge that. We still mourn and feel that. But we did relatively well in trying to keep this virus as contained as we can. But alas, here we are. New numbers, an uptick. Everything is open back up, and we're just wondering what's next. So I'm not going to rant on anymore, because I know people have questions. We had some questions that came in. There's some that we anticipated. And on that note of coronavirus, I'm going to start with you, Frank, because you're going to be the guy in the hot seat today. And just ask, can you start by just detailing, if you would, the recent rise in cases, and what's the health department's message to the community?
Thanks, Leslyn. Yeah, there's obviously been a significant uptick in cases. I think everybody's aware of that now. We saw it mid-summer as summer travel started to begin, and folks would return, and we had cases starting to rise. And then subsequently, when higher ed re-engaged, we've seen the most significant spike in the last few days related to that. I will say we had expected that we would see cases this fall. And we'd been talking about that through the summer when numbers were really low, that as we started to loosen the restrictions or relax the public health guidance, we would expect to see some cases. And I think that's really what we're seeing now. I think you mentioned we were really fortunate last year. Everyone listened and did what we asked them to do, and we had very, very low numbers compared to most other parts of the country from cases. And so I think this spike is doubly disconcerting because we're not used to this. Counties around us were seeing these numbers pretty consistently, throughout last year. So we certainly recognize that this is different, and it feels very different. And I think you used the word scared or scary. And yeah, I'm sure it can feel that way. And what we hope to do today is kind of shed some light on what's going on and what people can do and what we're planning for. I would start with, as we vaccinated so many individuals in our community, and again, we thank everyone that's gotten out and are still getting out to get vaccinated. That is the single best way to protect ourselves against the virus. We're learning about the vaccine and how it's being impacted, particularly by the Delta variant, which is the predominant variant that we have here in our community. And we are seeing cases. We're actually seeing cases in a much higher rate than most of the rest of New York State. It is still very rare in New York to be vaccinated and become positive with COVID. But that's not the experience that we're having here. And so for the folks in our community, they're certainly feeling something different than they may be hearing on the news at night. And we want to explain that a little bit. Some of it has to do with our vaccination rates. When you have a very highly vaccinated population, particularly the higher education students who are in the 90+%, because it was a requirement for school. When you have cases, they're going to be in the vaccinated population. And so that's a bit of what we've been seeing. We're also learning that the vaccine, particularly with the Delta variant, you can become positive and you can transmit it to others. That is a fact. What we're hoping and what we're seeing with the vaccine, though, is that it's having an impact on the severity of disease. right? And we're not seeing large numbers in the hospital like we would have last year if our numbers were this high. So that's the promising note, and that's really what we're focusing on now. We've spent the last 18 months or so really focused on case counts, and we're still going to watch those case counts, and it's certainly concerning, and they're higher than we would like them to be. But our focus really is on the severity of the disease and what's going on with our hospital system and what's happening to folks that are contracting COVID in our community. And thankfully, our hospitalization numbers are still pretty low. We are seeing some folks in the hospital with that have been vaccinated. So we're not saying that if you're vaccinated, there's no chance you'll be in the hospital. And we have seen some folks that have ended up there. Generally speaking, most of the vaccinated individuals that end up in the hospital have some underlying condition that if they had had any respiratory disease, they likely would need some hospital support. So, that's not to say that the vaccine is that you can't end up in the hospital with a vaccine, but just adding some context to that. What we do know is that all of the people that have needed ICU care have been unvaccinated. And unfortunately, those that have passed away have all been unvaccinated. So really, the message here is please get vaccinated. That's what we need. The vaccines are working to keep people out of the hospital and decrease the severity of the disease. We have seen an uptick in cases. It's predominantly been over the last week in higher education students who are fully vaccinated and are most times either asymptomatic with no symptoms or really have mild symptoms. We've not had a single higher education student admitted to the hospital as of yet. So that's the good news. The case numbers are up. That's not good. We don't want to see that, and we're working real hard to get those folks into isolation and quarantine. But ultimately, what we're looking for now is what is the severity of the disease, and are we keeping folks out of the hospital? And so far, we've been able to do that.
Thanks, Frank. Can you share a little bit more? So I've been vaccinated, and yes, it is scary to hear that, those of us who are, rolled up our sleeves and got our vaccines can still get infected. Even scarier to hear that some people have been hospitalized. How about the booster? Can you share, should I go get my booster shot? I got vaccinated in March. Is it wearing off?
Well, right now you're not authorized for a booster shot. So no, you can't go get it yet. The immunocompromised individuals, however, have been authorized for a third dose. And I want to talk a little bit about the difference between that third dose for those folks and a booster shot. So the reason the immunocompromised individuals can go now, and there's not a time frame from when their second dose occurred, is because we're giving a third dose, because oftentimes with those immunocompromised individuals, when they got the first dose, their body didn't have a reaction because they're immunocompromised and it wasn't able to. So they didn't have the full effect of getting a second dose. So really their third dose to them is almost like a second dose based on how their body might react to it. So that's why those folks are eligible. And if they meet the criteria, there's information on our website on who does, either with an immunocompromising disease or taking medications that are immunosuppressors. They can seek out a vaccine. Pretty much anywhere that is giving vaccines should be able to take care of that for them. We do ask that they try to get the same vaccine that they got the first time. You want to have a 3-shot series. So that's a little bit different than a booster shot, which I think was your question. There still is not approval for booster shots. There's the ACIP, which is the group that reviews vaccine information and makes recommendations to the CDC and FDA, are still reviewing the data. They met last week. They started that review. They're going to meet in a few weeks again and continue that review. And ultimately, they'll make a recommendation, one, on whether or not boosters are recommended, who they're recommended for, and when they're recommended. So we're waiting for that information to evolve. And if and when they are approved for booster doses are approved, we are preparing to be able to provide those to our community. Again, working with CHS, we're likely going to have an operation at the mall, albeit scaled down from what it was before, but there will be an option there. You can walk into most pharmacies right now and get a vaccine. We'll expect with the boosters, you'll be able to do the same thing. And many primary care and other healthcare providers also have the vaccine. So it's more readily available. The vaccine is available. So we're not limited by supply at this point. So it won't feel the same way it did when we got our first and second doses. It really will be, if you want to get a dose, you'll really just have to look first to your local pharmacy or to a vaccine clinic that we might be operating with Cuyahoga Health System. So stay tuned on the booster, more information to come, but as soon as a decision is made, we'll be ready and prepared to first communicate that out and let folks know how to access those boosters.
All right, thank you for that. And Frank, just to go back a little bit in terms of the spread and the uptick in numbers that we're seeing here, any particular reason? Are we seeing more gatherings and parties? You mentioned, things are opened up, guidance and restrictions have been lifted. People are returning to our community, students are coming back. Are we seeing, some of those in clusters, parties, etc.?
Yeah, so when the numbers started to go up in the middle summer, it was predominantly around travel and household contacts. Those were really the main things we were seeing, and we've communicated about that. More recently, particularly with the higher ed students, college students, university students, they act different than someone that's not in that setting, right? It's not good, bad, or indifferent, it's just different. And they live communally, right? Either in a dorm or in houses with significant numbers of people, and they gather, right? They gather for parties and other things, so that really was some of the driving force in where we've seen the cases. It's not that they were necessarily doing anything wrong, right? We invited our higher ed students back to the community. We want to be in person. We really, want to get our community fully functioning again. Told vaccinated people that they could go without masks for a while. We also didn't really limit gatherings at all. So they were doing what was asked. So I don't want folks to think that the students were somehow misbehaving and that's what got us here. What we didn't know was how the Delta variant was going to react to the vaccines. So that's a component of it. And we have recommended that masks be worn whenever anyone is indoors and around other people in our community. And that's really what's going to help stop the spread. And I think as our higher ed population begins to get used to that little adjustment, I think we'll start to see the numbers come back down in those populations. So that's good news. We've said before, they are predominantly vaccinated, and those cases have either been asymptomatic or mildly symptomatic. And that's really the good news, that we do have numbers, but the illness has not been strong in those individuals.
All right, thank you. Frank, I'm going to give you a voice a little break and then I'll come back to you. And this could be for either of Amy or Lisa. How is the county supporting people who have, long-term effects of COVID? Is there anything that we're doing, or do I have to go back to Frank?
I would defer to Frank on this question, unfortunately.
Try that.
Frank, I was trying to give you a break.
Yeah, sorry, Frank.
I'll break.
Yeah, so it's a good question. What we're starting to see in some of the data, and it's not conclusive yet, obviously we're still learning, but in those that are vaccinated, we're not seeing as long a time period for those that might have long COVID. Certainly those individuals have access to our healthcare system and all of the things that can help them navigate through it. I think long COVID is something that we're still understanding, and we'll learn more as time goes. Hopefully through vaccinations, we will reduce the amount of people that do suffer from long COVID. And if they do, it will be a shorter period that they're experiencing symptoms.
All right. Well, Frank, you're going to keep going. I'm a nervous mom, like many other parents out there, because school is starting next week. K through 12 starts next week. Can you talk a little bit about our priority to keep kids safe? What are we doing? Keeping our schools healthy? What do you know?
Yeah, and I'm right there with you. You know, I'm going to be handing my daughter over to the school next Wednesday, and I understand the anxiety that goes along with that, particularly with, you know, some of the unknowns. The first thing that I would say is last year, what we know, kids were safer in school than they were during their times outside of school as far as exposure to COVID was concerned. We had minimal transmission within our schools. And predominantly the cases of COVID that were found in both children and adults was from outside of the school, that they encountered it somewhere, you know, during their off-school hours. So that's the first bit of good news. Delta is different, right? That's the first question that comes up when I say that. What about the Delta variant? And yes, Delta is variant. The Delta variant is more transmissible, and we know that. But that's why we're not just going back to school as we did in 2019, right? There's still a mask mandate, so everyone in the schools will be wearing masks. The state is initiating a vaccine requirement for adults that are in the schools. So more information we're expecting anytime to give us more details on how that is going to work. We've been working with our local school districts to put testing protocols in place. We're awaiting some state funding to be able to implement that, but we have some planning in place associated with it. And we've been working with our school nurses and other school staff on isolation and quarantine and what that's going to look like and how we're going to successfully do that. But our goal is to keep kids in school in person as much as we can. We're going to do that as safely as we can, and we'll obviously monitor what goes on. And if something changes and we see something different happening in the schools, obviously we'll adapt. But right now, we know there are negative impacts to our children when they're not in school. I think any parent can probably say that over the last year. School was not the same, and their child likely did not make the same gains or have the same experience that they would have in person. And so we know that there's risk to the children for not being in school. So we're trying to balance that. We're trying to do it smartly by having some restrictions still in place, increasing some density so all kids can get back to school 5 days a week. And we're going to have testing and other monitoring with our school partners to try to make the school day as safe as we can for our kids so they can be there in person and have the full school experience.
Thank you. There's a follow-up question that came in, and it's, are we supporting districts other than Ithaca City School District on surveillance testing? And part two to that question is, then why are different schools doing different things?
Yes, so the first answer is yes. We are working with all the school districts, including we'll be able to provide support to private schools as well.
Great.
So anyone that's doing pre-K through 12 will have access to the testing protocols, and we've set aside enough resources to be able to do that. As far as why different districts are doing different things is that right now it's still really up to the district on how far they want to go with testing. That is likely going to change, I think, as the state guidance becomes more clear in the next few days. And so it might get a bit more consistent across the districts. But what I would tell you is that we meet regularly with all of our superintendents to talk about what their questions are, concerns, try to help them navigate through all the different guidances. But ultimately, from the health department to the school districts here locally, from the local health department to the school districts, we are making recommendations and trying to help them understand the guidance, but they're ultimately making the decisions about how they implement that guidance.
All right. Thank you, Frank. Maybe this time I get Amy or Lisa to to give your voice a break. Can you share Tompkins County, well, Frank, I think it's you again, how the department's capacity to manage response? What is the county doing? That second half of it, maybe Amy, Lisa, you all can chime in.
Yeah, I'll start and certainly let Lisa and Amy chime in. So we actually maintained some of the extra staffing that we brought on board even through the summer when numbers were really low in anticipation that we might see more cases. We are rapidly trying to bring more people on because we did get a little bit of a shove there over the last weekend when we had those cases come in from higher ed. So we're recruiting. We put out a press release. We're looking for nurses, per diem nurses. What we call project assistants would be people that help us with contact tracing. And we've had quite a response. And I know we're going through
Okay.
applications and interviewing folks now. So I'm hopeful we'll have support on hand pretty quickly to help us, ramp up for what we're seeing. And I'll let Lisa and Amy talk about the county's help for us as well.
I can start, Lisa, and then I'll turn it over to you. And I think one thing I will point out is Frank and his team are very humble. What they do at that health department is pretty amazing. The hours that the staff are putting in and how they are supporting one another, how our own staff as the county are supporting the health department and attempting to, make sure that the idea of we all are in this together really does ring clear through that department. And like so many in the community, they are tired, but they also are the ultimate professionals. And so as we are building up their capacity again, that support is definitely needed, but they are really doing a lot up there. And so I think everyone just should know that. And I know there are so many questions and so many frustrations as we go through all of this, but you do have some amazing leaders there that are doing the day-to-day. So enough of that, and on to what we're doing kind of with our own staffing. And I can talk a little bit about our mandatory vaccination program that we have rolled out with the county. So we are rolling out a mandatory vaccination and testing program for all county employees. We've also enforced masking within all of our county buildings and spaces. So that vaccination and testing program begins on October 1st. We're logistically working through all of that right now. And we are ensuring that when members of the public enter our facilities, that they are going to be safe in doing so, and that our own employees are as well. So that is a lot of what we're doing. Lisa, I don't know if you want to add in more on the county response.
I'll echo certainly what Amy and Frank have said, and want to give a shout out to all of our employees at the county health department and all of the other departments that are now currently redeployed to support our health department. They've been tremendous in this. And also to our legislature who passed the mandatory vaccination and testing program, which we're going to be implementing. It's one of many tools available to us in the toolbox to try to help keep our workforce safe and the public safe whom we're serving. So I'm glad that we're doing that as an employer in the community.
Thank you. Thank you for that. Let's talk a little bit more about vaccines. And Frank, I'll turn back to you. On August 23rd, the FDA authorized full approval of the Pfizer vaccine. Can you explain this difference between EUA and full approval?
Sure. So emergency use authorization is exactly that. What they do is they weigh the risk of not using the medication against any potential unknown risk outside of what they already know from the pre-existing trials. So it's impossible to know kind of longer term effects of a vaccine, until you have a longer term, right? So in that you're taking, they're doing a calculation on the risk of not having the vaccine versus having it. And that's what gives us the emergency use authorization. I would still say it's not a 50-50 measure, right? Even to get emergency use authorization, there are very stringent protocols that have to be followed before any vaccine would be allowed. Way more strict than even the prescription medications that we all take, because we know we're giving the vaccine to generally healthy people, and we want to make sure that they stay that way. So even with emergency use authorization, there's tons of protocol that goes into approving those. The full approval essentially is now the FDA believes they have enough information from additional studies in large enough populations to say that yes, the vaccine is safe and effective for anyone that meets the criteria associated with that vaccine. So that's good news. I know there are a lot of people that were saying, well, I don't want to take the vaccine until it's fully approved. Well, now it is. And hopefully that means we'll have some more folks seeking that Pfizer vaccine.
Okay. All right. Well, do you think that young people ages between 16 and 18, should they be required for all of them to get vaccinated now that Pfizer has this approval? Because the Pfizer vaccine is the one that they could get, right?
Yes. Yep. Yeah. So the Pfizer vaccine you can get 12 and up. It's only fully approved for 16 and up. So just to be clear there. The short answer for me is yes. I, as a public health professional, I think similar to the condition for attending schools, for many other vaccines that we have, that the COVID vaccine should be a part of that. It's not my decision to make. Ultimately, the state, through the New York State Department of Health, will make those determinations about school-based children vaccine requirements.
And there's been a lot of attention paid, to Pfizer since it, got the FDA approval, Moderna, but not a lot of information floating out there. But Johnson & Johnson, what's the latest on that? Anything new?
Where Johnson & Johnson is still hard to come by. They're not manufacturing it, and the FDA is still reviewing manufacturing processes that were in place. They had some issues at the plant that was caught right there, so no risk to anyone. But until that all gets straightened out, the FDA has not authorized additional production. So it's hard to come by J&J right now. If the question is, what is its safety? If you received a J&J vaccine, it's just as safe and effective as the Pfizer and Moderna. And so there's no need to worry if you had a J&J vaccine. We're just waiting for that process to get reauthorized again. And hopefully production will begin so we have that third option more readily available for folks.
Yep, you read my mind. That would have been the next part of the question. What's the safety issue with it? And is there any word on or updates on vaccine approval for children 11 and under?
Yeah, we still haven't heard much. And unfortunately, the last that I heard, it was looking like closer to the beginning of next calendar year before we might know that. So, but it's kind of been going back and forth with the beginning of next year, sometime in September, October, and then next year. And then so what we don't want is we don't want it rushed. We want it done right. And so, I'm confident that the FDA will go through the same process as it has and make sure that it has the appropriate data to make the appropriate decision on when to authorize vaccines for that age group.
All right. There's some other questions that came in, so I'm just trying to see. We'll get to mask in a minute, but I do want to ask a little bit more about the vaccinated and unvaccinated. Obviously, like when we first started, the public wanted a lot of information on who, what, where, and when. So can you share any more information on recent positive cases, like source of exposure, public exposure, vaxxed or unvaxxed, etc.?
Sure. Yeah. So I said in the beginning, I said a little bit about our experience here is a little different than what folks are experiencing in the rest of the state and around the country. We've been hovering between 35 and 55% of our cases being vaccinated individuals. I can tell you that the next time we report it, it's going to be higher than 55% because we had that huge influx of higher ed students testing positive, and they were predominantly all vaccinated. So along with this spike, we're also going to see that percentage of positive vaccinated individuals go up pretty significantly. So giving people a heads up when they see that next bit of data when it comes out in a week or two. So we are seeing a little bit different in our community. And we have to remember, we said this even last year when we knew less and things were good for us, that just because something's happening here, it's a small sample size, right? And so we have to look to the broader picture and try to make sure we're not losing sight of the totality because of our small sample size. So we are still seeing that it's relatively rare throughout New York that vaccinated people are testing positive. our rates are higher, and there's no denying that. But what we know is that people can test positive and they can transmit the virus when they've been vaccinated. What we do know is that vaccinated individuals generally have smaller viral loads, and so therefore it reduces the amount of time. I'm sorry, they do not smaller. They have their viral load counts are for a shorter period of time, and so therefore their infectious period can tend to be shorter, and therefore have less potential for exposing other people. So there's still benefit related to transmission with vaccines, and the most important thing is what we are finding almost in every case, that the vaccinated individuals are not seeing severe illness, and that's the important part. To your question about where are people contracting this, I think now we're at about a 50% where we know where they contracted it from, and then 50% where we haven't been able to identify a very specific contact point. So some of that is just, sometimes we can't figure it out, right? It doesn't mean that there isn't a contact, but what we do know, as I said, travel and household contacts early or midsummer, and then most recently, it's really spiked in the higher ed population who have that communal living where they're together for long periods of time, or they're gathering together in larger groups, with or without wearing masks, and that potential continues. So what we do know is that we don't think that it's happening walking past someone in the grocery store, right? Really what we're seeing is that it takes more prolonged exposure to somebody, normally with some inconsistent mask wearing, that generally is what's causing our transmission. So as you said in the beginning, wearing a mask, reducing density wherever it makes sense, and just being mindful of your surroundings are still the best ways to help limit the spread.
Yeah, thanks for that part about not walking past somebody in the grocery store, because I think part of that question had to do with people being concerned about public exposure. And the more information people get, I think that the better they are. It's like, is this happening, like you said, communal living, so on and so forth, or is this real massive public exposure that put us in that category of being described as a high transmission county, which I'll ask you just to share a little bit more. Like you said, we're a little different here because of all the factors you mentioned. Is there more to what makes us high transmission?
It's really a percentage per 100,000 population that the CDC has established. So we're being measured on the same standard as everyone. And that's really what puts you into those transitions.
Okay.
Leslyn, you brought something up about the public exposures. I'm not saying that there's no risk, right? I can't say that. I can't say that about anything, right? There's always some level of risk. What we're trying to communicate is that, generally speaking, what we're seeing is that when it's more prolonged contact, particularly with inconsistent masking, that's where we're seeing transmission. There may be 10 cases where folks, had limited exposure and became infected, but that is the rarity. And it's really about those settings where you're around people for longer periods of time.
Okay, let me ask a little bit about guidance, some of the guidance. We know we're still encouraging, or we're still saying, please wear your mask, wash your hands often, keep your hands away from your face, etc. But in terms of quarantine guidance, what's new, and anything new, any updates on, especially for people who are vaccinated, who might be asymptomatic, what's the guidance?
Yeah, no, thanks for asking that, Leslyn. We did put out a press release earlier this week related to quarantining. And as much as we try to get as much information in there and make it as clear as possible, it's hard to anticipate, all of the questions that folks would have. So generally speaking, things haven't changed that much. A symptomatic person, let me start. If somebody tests positive for COVID, they are in isolation for 10 days from the onset of symptoms or their positive test if they don't have symptoms. That hasn't changed, and that's not likely to change. right? So I want that to be clear that in anything that we put out this week, it was not intended to be interpreted that somebody that's a positive case can go back to work. That can't happen. If you're in isolation, you're in isolation. Doesn't matter what you do. So that absolutely has not changed. As far as quarantine is concerned, we are still looking for close contacts. That's really what we're looking for. And what we define as a close contact is someone that was within 6 feet for 10 minutes or more of the symptomatic case. So that then becomes a person of interest, right? A close contact. We then look at those individuals, and if you have not been vaccinated or you're symptomatic, whether you're vaccinated or not, you go into quarantine. And you go into quarantine for 10 days, right? So quarantine is still 10 days. You'll remember way back when it was 14 days, and then we released 10 days. There's been a little bit of confusion around that because even though we release you from quarantine at 10 days, we ask you to continue monitoring yourself for symptoms that full 14. Right? Because the incubation period is still 14 days, the potential, but the probability of you incubating after day 10 is very, very small, but it's not zero. So we're still asking people to monitor themselves from symptoms, but they are released from quarantine. So I know that created a little bit of confusion, and I wanted to clear that up. And then I think the other piece that we were trying to explain that might have created more questions was for vaccinated individuals. So even if you're a close contact, say you're a household contact, which means you're almost immediately a close contact of a case, if you're fully vaccinated and have no symptoms, you do not go into quarantine. We are not putting you into mandatory quarantine. That is CDC and state guidance, and we're following it. And we've been following it that way pretty much since full vaccination was in place. So that really hasn't changed. What's changed a little bit is really the guidance that we're giving to those individuals. So because we've seen transmission in our vaccinated population, we thought it prudent that we ask those folks, while we're not mandatorily putting you in quarantine, there's a chance based on what we've seen in our community that you could become positive. So we're asking them to be consistent about mask wearing. We're almost asking them to do a self-quarantine. If you can, stay away from people that you don't necessarily have to be around. Wear your mask. If you have to be out in public, try to keep 6 foot of distance and wear your mask at all times. And most importantly, if you're going to be around high-risk populations like the immunocompromised or people that are unable to be vaccinated, including young children, if you can, avoid those types of exposures, right? Try not to be around those people. What we're not saying is that you can't go to work if you have to work around those individuals. And I know that might seem contradictory, but really what we're saying is we want you to be extra cautious. We're not putting you in quarantine, but we want you to be extra cautious because what we've been seeing in our community, but we also recognize that we need to still work and function as a community. And that includes having our schools operational and healthcare and other things where somebody that could be a contact but is vaccinated could come into contact with other people. So we're really just asking them to be cautious, wear their mask consistently. If they're going to be around those at-risk populations, to really make sure they maintain 6 feet wherever possible, again, and keep that mask on.
And I will chime in and say we also have to recognize that we have, a very large population of children who, aren't and can't be vaccinated. And so we need to be mindful of them and stay away and, like you said, do our own self-quarantine and monitoring and so on and so forth. So thank you for that. Now let me look here. Let's go to masking because that has been, a hot topic. We know throughout our country, there's, lots of debate around it, lots of opposition to mask or not to mask, mandatory, non-mandatory, etc. So, question came out, why are we not initiating a mask mandate? How can we ensure more compliance with some of the guidance that we've given if we're not going to have a mask mandate?
Yeah, that's great, Leslyn. And I so appreciate that most of my colleagues are getting the exact opposite. They're like, no masks, no mandates, none of this. So it just goes to show how much our community cares about one another. And
Yeah.
so I just want to start with that. This is an amazing place to do the work that I do because of the way you just phrased that question. Most other places it would have been phrased, you're not thinking about doing a mask mandate, are you? So that's the good news. So to answer your question about mandates, we've been recommending indoor masking for everyone, vaccinated or not, for weeks now. And from a public health perspective, the idea of mandate, the only thing that really changes is that there's some sort of enforcement that goes along with that. And I think what we've proven as a community is that we can do this without that. And I know people will respond with, well, you go into the store and you see people without a mask. And yes, I understand that. But what we're asking of everybody is to have some self-responsibility in this, right? First, please wear your mask when you're indoors. But second, if I go into a setting and I see a bunch of unmasked people, or there's too many people and I feel uncomfortable, in almost every instance, I can turn around and remove myself from that situation. And I know that can be frustrating because you have things to do, you've got your grocery shopping, whatever it might be you need. But in most settings, we're able to just say, you know what, I don't like this. I'm not gonna expose myself like that. And that's really the approach that we're talking about, because we can't move back towards a lockdown, right? So if we have a mask mandate and our numbers continue to climb or even just maintain, is the next conversation is about, well, are we going to stop doing things? Like, are we going to close restaurants? Are we going to close schools? We've been through that. And we went through that because there was so much unknown about the disease that we had to take dramatic steps in order to prevent its spread. What we're seeing right now is that, yes, we're seeing cases go up, but our community is re-engaging and we're getting back to what we need. We know there were negative impacts from closing down, right? And at some point, those negative impacts begin to outweigh any positive gain that we get from limiting the number of cases, while at the same time, when we're not seeing the severity of our illness increased by hospitalization. So this is really we're in a transition point. We're moving from pandemic to endemic, right? And so the difference is in a pandemic, you're still looking at the potential of eradication and trying to do everything you can to eliminate the disease that you're facing. When it becomes endemic, it's part of the disease pool in our community. And for like it or not, that's kind of where we got to. Some of it has to do with how we reacted as a country and a world earlier in the pandemic, but it is where we are. And so we have to begin to start to live with the idea that COVID is here. Our goal is to keep people as healthy as we can and focusing on making sure we keep them out of the hospital because that's an indicator of the severity of their illness. And so while case numbers may go up, if we continue to see our hospitalizations where they are at this low level, it's extremely important that we as a community get back to business and get back to doing the things that help us in so many other ways be healthy. And so I know that's hard, and I've been grappling with it, right? Because I knew I was going to have this town hall and I was going to have to try to explain this to folks. And it can be challenging to kind of work through, because we've been telling folks, do this, do this, do this, and they've been doing it. And that really helped us through last year. And now for some folks, like, well, why aren't you telling us to do this, this, and this again? Because our numbers are going up. And it's really about, we're moving forward through the pandemic towards this endemic phase. And we have to focus on the severity of illness, because if we have folks with mild cases or no symptoms, that's a win, right? The vaccine's working. Everything we did over the last year has gotten us to a point where we're keeping people out of the hospital, which means, one, they're not severely ill. Two, our healthcare resources aren't being overwhelmed. And three, we're not limiting all of the other healthcare that we need people to do because we're so focused on COVID. So I hope that made sense to folks. I know it can be hard to kind of grasp, but that is really where we are as a community right now.
You're right, Frank. It is really hard to grasp. And even me sitting here, I hear you, but it's hard. And, I want to just read this out loud, because this is something that, throughout social media, people have been saying, and I'm hoping that those folks have watched and heard your response, which I think is very rational. though hard, it makes sense. And, someone wrote or people have written, there needs to be a mask mandate for indoor situations with other people not in your immediate household. That's a very specific thing they're saying, not a big general mask mandate. Voluntary masking isn't working. We have now surpassed the highest number of cases since the beginning of the pandemic. So big concern is not just one person, number of people who have posted this to social media, and they're saying specifically indoors. And I know that some businesses, county, city, other places have been saying indoors, you must have your mask on.
Yep.
So
and
people
I think,
are concerned.
and you hit on something there, Leslyn. And when I'm talking about a mandate, really what we're talking about is a mandate from the government saying everybody has to wear a mask.
Right.
There's nothing stopping. And I would encourage every business in town, I've recommended to them that everyone that comes indoors be wearing a mask. And I would really encourage businesses to take the lead of the county legislature and making it a requirement in their store. It really needs to be about us as a community engaging with each other in a way that we think is appropriate. And forcing it from government isn't going to end up netting the results that we want, from my opinion, at this point. I think we've moved past that, where everybody should at this point have access to information about what the best decisions are based on the recommendations that public health officials are making. We need our community to come be part of that. If your local shop that you go into isn't requiring masks, try to have a conversation with the manager and ask them, what's your thinking around this? I have concerns when I come in here, and it'd be great if you would require masks. Now, you may not get the answer you want, and we don't want it to become confrontational, but that's what we have to do as a community, is we've got to live together and figure out how to communicate about what's important to us. A government mandate really only brings in enforcement, right? And that is, enforcing a mask mandate would be challenging at best. And quite frankly, I don't think would end up with the results that people are hoping for. If somebody's not going to wear a mask, they're not going to wear a mask. And unless there's the pressure from the place that they're entering that says, look, we don't want you to come in here and potentially put others at risk, please wear a mask. That's what's going to drive it. And I'm hoping that our community will respond and react to that. Because I don't think going down the mandate path that only leads to shutdowns and other things that I don't think anyone wants or would really result in what we're looking for should be something we're considering.
Yeah, I appreciate hearing that. Tompkins County, people are good about asking questions, about, making suggestions, about all those things. And we don't want to lose sight of that civility, even if it's asking the manager of the grocery store, like you said, what are you thinking? What are your thoughts? That's important because, like you said, lots of unknowns, and I appreciate the, not necessarily pandemic at this point, but endemic, that it's here. And, we have to figure out how to live with it and keep people from getting really, really ill, overwhelming our healthcare system, keeping folks out of the hospital, etc. So thank you for that. Let me see. I'm going to switch to Amy or Lisa at this point, and then I'll come back to you, Frank. Our students, our higher ed students are back. Our higher ed community is live and in person. What is our county message to the college students in our higher education community? What's the message we want to send to them?
I'll start off and say we very much value our higher ed partners and the students and the life that they bring to our community, and they are community members just like all of us. So I guess our message, the message that I would want to say is we welcome you, and that we respect you, and we hope that you respect yourselves and in others in the community as well by following the guidelines that we're all trying to follow to keep each other safe in terms of mask wearing and social distancing and all of that. So
Thank you. Go ahead, Amy.
I was going to say, I think Lisa covered, I mean, a big part of our community is our higher education partners. We have been built with them in every aspect. And I think as we talk masking and we talk distancing and vaccination, it's really important that they follow the cultural norms that we're setting here. And Frank hit on it earlier. We are not like a lot of other places where we have people asking for more. And I think encouraging our higher ed partners and the community as they come back to accept that and understand that we have this obligation to support one another, this obligation to make sure that we really are committed to protecting one another, which means, you know, masking and distancing and all of those things. And as we continue to see cases, how we get through it is to continue to work together. So I think that's a piece of this, and also to have patience with one another. I think that's been key to me throughout this entire thing, is we haven't experienced all of this before. And it's the first time we've brought all the students back on campus since the pandemic began. So it does look different than it did, you know, just 6 months ago. We also have way more vaccines, and we have a highly vaccinated population, which looks not like other places. So I think that a lot of that comes into play now. And so we have to learn how to have patience with each other and continue to learn throughout all of the pandemic. That's a big thing, is things continue to shift and change, and we need to do it together.
Thank you for that, Amy and Lisa. And I would chime in and say, you know, from our government message, and a message we've put out there in the media, is that, you know, Tompkins County has done really well throughout this pandemic in 2020. We all hunkered down, we, you know, trial and error to the point that, you know, lots of what we did were being recognized as gold standard operations and actions that we took. And it's not just, you know, a small group of people doing it. It was all of us, including the students who were here, grad students and families who were here. And we want to continue to do that. And in this new phase of what it is we're going through, we want to continue to set those standards for working well together and doing everything that we could, taking gold standard actions, platinum standard actions that will help us to keep this disease as best we can under control and save lives. So to everyone coming into our community, from us, we as a government, we have invested resources into the testing, you know, the vaccines, the staffing that we're hiring or we've kept on board. And we want everyone else to join us in this fight to keep this coronavirus under control as best we can here in Tompkins County. So thank you for being here. Thank you for, you know, choosing to come to school here. And thank you in advance for working with us in this fight. As we continue to move forward, we know that restrictions were lifted. Most businesses and operations were back to full capacity. Is there any updates on any of those? Are we looking at potentially, do you know, because I know a lot of it came from the state, if we might, you know, reduce the numbers of ridership on the buses or anything like that? Indoor gatherings, any of that stuff?
I'm not expecting anything like that imminently. I think where our focus is now is on those high-risk populations, right? So that's why you see the governor has implemented mandatory vaccinations for certain healthcare settings. that we've got additional requirements in pre-K through 12 settings because we have unvaccinated children. There's still protocols for nursing homes and places that treat the elderly. So it really, that's where our focus is, right? We've learned so much that the real damage can be done in those high-risk populations. We need to protect them with some extra measures. The rest of us, if we take some basic steps, the masking, trying to stay 6 feet as much as we can, hand washing, staying home if you're sick, right? Please, please, please stay home if you're sick. Those are the things that we do that will help limit the spread enough that we'll be able to protect the most vulnerable amongst us. And that's really what we're focused on right now. And I think that's likely how you'll see guidance and directives kind of evolving from here.
Right. And Amy, we still have the options for people to call 211 for transportation if they need transportation, to get to testing and so on and so forth, food.
Yeah, 211 has been an amazing partner throughout all of this and continues to be an amazing partner. And they assist with all sorts of things. I think that's one of the pieces that I know even our own staff wasn't aware of how much 211 can do for people. So if you need assistance with food, transportation, even housing, they are there and they can support whomever with that. The one change that we have done is rather than bringing people to testing, we're able to work with partners to bring testing to them at times. So it could be, there's a lot of different variables of how we do that, but 211 is definitely the partner to call.
All right, Frank, I have one last question for you. Can you give an overview of who has been hospitalized? And it could be for any one of you, is why don't we release more information about the hospitalizations?
Yeah, so I think we've been pretty consistent from the beginning of the pandemic that we still have an obligation to protect people's privacy. And as much as our hospital numbers have fluctuated a little bit over the last couple of weeks, the numbers are still relatively low. So we're trying to be sensitive to the privacy of those individuals. What we have had tried to do is share what we know related to the disease. And as I've said, we've seen it, the vaccinated, hospitalizations fluctuate over time. What we haven't seen is vaccinated people needing intensive care. We haven't had anyone pass away yet that was vaccinated. Generally speaking, hospitalized vaccinated individuals go in, have a short stay, get some support, and then head home and recover. What we're seeing in our intensive care unit are unvaccinated individuals. That's where the disease, becomes more severe in those populations. I think yesterday we reported 6 people in the hospital. Half of them were vaccinated, right? 3 of them were, 3 of them weren't, right? So it's 50%, but it's 6 people. So it's hard to draw conclusions when it's such a small sample size that we're dealing with. But what I can say is, generally speaking, the vaccinated individuals that are in the hospital have an underlying condition that any respiratory illness likely would have resulted in them needing some hospital support.
Okay, thank you. There's a follow-up question. What type of you mentioned underlying conditions, what type of underlying conditions, anything that's beyond sort of the respiratory illness?
So the respiratory illness is potentially exacerbating it. So things that you might imagine, folks that have difficulty breathing from COPD or other lung-based issues. That's generally what we're talking about. Some elderly folks that have had decreased lung capacity, potentially, those are the types of underlying health conditions. So what we're saying is that had they caught the common cold rather than COVID-19, because of those underlying conditions that compromise their ability to breathe, it creates the need to get some support from the hospital.
All right, thank you very much. I didn't see any more questions come in. And I think I'm gonna sort of wrap this. The guidance is out there. There's lots of information on the health department website. We encourage people to check there. There are FAQs. There's a lot of information there. Vaccinated people, you made it clear. If you're vaccinated and you've been exposed, we're not mandating that you quarantine, but we do ask you to sort of self-quarantine if you know you've been exposed. 10 days up to the 14 days, and just monitor your symptoms. Let us know. We want to protect our children in the community who are not able to be vaccinated at this time. We're not having a general mask mandate, but we know that individual businesses and schools, etc., they are putting out their policies, and we encourage our community to just follow those, to be kind to each other. Let's not be confrontational. This disease and everything else that's been going on in the world has really sort of taken its toll on us. Mentally and even physically in some sense. I know for me and many others, people are not sleeping at night because our brains are on overload, just thinking about everything and what can I do? What more can I do to help? So that's a question that I'm, just thinking about as we go out of here. I'm sure there'll be more questions to come from the community, and we'll do this again. Just letting people know. We've just had, a lot going on. So I want to ask of Lisa, Amy, Frank, what positive outlook? We're just starting September. By the way, it's my birthday month. If anybody wants to give me a present, I'm just going to put a shameless plug. I'm either going to be 55 or 56. It'll be on Facebook. The jury is out on which age, and the, main primary witness to the age is no longer with us. And so my shameless plug for my birthday is that I would like 55 people who have not been vaccinated to give me the present, who know me, who care about me, who care about this community, who care about their own loved ones, to please go get vaccinated. That's the birthday present I'm asking for this year. So that's my shameless plug. What is one positive thing that you look forward to for the month of September, aside from celebrating my birthday, of course? And everything that's going on, we talked about the pylon. What are you looking forward to? Positive outlook.
All right, I'll go first. I'm looking forward to school starting. I have a daughter that's starting first grade, and she loves school. And I'm excited that it's going to look a little bit more normal, although she was a kindergartner last year, so she's never known anything different but COVID. But she's so excited about school, and I'm excited that we're moving closer and closer towards what it will be a normal school experience for our kids, because they deserve that. And we're going to work really, really hard to make sure that they get to experience that.
Thank you, Frank.
I'll jump in and say I'm looking forward to the fall weather coming on. September's a beautiful month to celebrate Leslie's birthday, but also to enjoy the fall. It's a little easier to sleep at night, and to still be able to gather with friends outside. And I think it's just beautiful in the fall. So I'm looking forward.
Thank you, Lisa. Thank you.
And Leslyn, it's also my birthday month, so we'll share that.
Double the vaccines.
There you go. Yeah, we can add 40 more there. So for me, I think one of the things that makes me hopeful and is the return of kind of the life that the community has with our students and everyone here. You can feel that buzz coming back. And that just gives me hope and delight, because we do have that high vaccinated population. We have that respect, and I just want to see that be built off of each other. So seeing the teams continue to come together and support one another, that gives me a lot of hope.
Thank you. I'm going to wrap up and say, yes, it's been a pylon. Like I said, it's been a lot for us, but there's also been good stuff. And I do want to take this opportunity to just reflect that on August 24th, although I wasn't here in New York for it, New York sworn in its 57th governor, making history, having the first female governor for New York, Governor Kathy Hochul, and we're so proud of that. She has been a friend of upstate. She's been a friend to Tompkins County, and we look forward to continuing to work with her in her role as governor. We know that the work has already begun with some of the mandates that have come from New York, some of the things she's passing, and even more recently, I think as of today, the state government, considering what's been going on with this virus, passing a bill for remote public meetings to be enacted again. We all missed each other. We wanted to be back in person in meetings and seeing each other, but we also know that these are the small steps that helped us to keep this virus under control. So congratulations to Governor Hochul. We're glad for, that bit of good news with everything else that has been going on. Good news that our economy here in Tompkins County has been bouncing back. If you remember last year, we were crying the woes because we were sort of at the bottom of the list of counties in Tompkins County with sales tax, and it was a rough one. We weren't sure if we were going to climb out of it, and here we are. So thanks to all of you who are watching, thanks to our entire community in Tompkins County, thanks to those who come into our county and support us, and thank you for joining us. I look forward to us working together to kick COVID-19 in the butt, whatever variant it is. We're going to work together to do that. Wear your mask, please. Thank you all.